Last Friday, March 11th, 2011, a catastrophic earthquake that struck Japan also resulted in a vast tsunami engulfing parts of Japan's coastline. That same day, a state of emergency was declared at the Fukushima nuclear power facility, which has subsequently experienced several explosions and fires. This combination of crises is absolutely unprecedented.
Harvard has some of the most incredible people who devoted their lives to international rescue missions. And Jennifer Leaning was a moderator and helped plan this. But what you could see instantly was she's not a moderator of an event. She's someone who has lived through international crises after another. And we were able to bring her credibility right into this situation. And that's what was really important, was matching someone with her background to helping with this event.
And joining us on the line from Tokyo is Dr. Takashi Nagata. He is an emergency physician who has been involved with the Japanese Medical Association in providing direct relief to the survivors who have been evacuated from the acute disaster zones in Japan.
The situation is we do not have water, food, gasoline, and information. I also asked the public that we need help from outside. The people in Iwaki City cannot call for help, but they need help.
So this is the decision dilemma, that if you order an evacuation closer to the plant and there is a significant, massive release, then you have all these people on the road who are not sheltered at all. And they can't move because the transport doesn't work or there's gridlock with traffic. And here they are out in the open with a plume going over them.
How many more days or weeks can a population go without these necessary supports and not get sick and not expire?
People can last for days or even, weeks if they have basic provisions. But I think after, a week or after 2 weeks, people will expect that some resolution is occurring.
So the clock is ticking.
But our value was some reassurance that the decisions that were being made were the right ones, and in a cry for help, for aid, that we were a vehicle for alerting people that it wasn't getting where it was supposed to be.
We were able to amplify his call for help from outside. That was truly significant.
When the event was over, it was very clear in my mind, as it was in the students from Japan, many of them were physicians, that we had done something very useful for that country. And it was something that we could do in the future for crises, of bringing independent advice into people's countries so they can hear a judgment beyond their own government.
I think that the forum will change the culture here at the school, at other schools of public health, in the public health profession, about how information is shared in order to make change. Information is shared with policymakers, with people on the ground trying to help with disasters, in events that are immediate, initiatives that are long-term. This is how you share information and have impact in the 21st century.
As they say in politics, this is a game changer. How a school with science and professionals interacts with people trying to alter the world, alter the outcomes of people's terrible problems, will never be the same.